Hello ma'am, have a blessed day. I am Hannie Rellon from BSN 2A and now I'm going to do return demonstration to drug administration. So first, I'm going to do an oral administration. So when we say an oral administration, it is the most common and least expensive and most convenient route of administration for the patients. In doing so, it is very important to remember the 10 rights of medication administration. And the rationale behind that one is to avoid making errors and also to ensure the client's safety. The 10 rights administrations are right patient, right medication, right dose, right time, right route, right education, right to refuse, right assessment, right evaluation, and also the last one is right documentation. So those that I mentioned are the 10 rights of drug administration. So before I'm going to go to the patient's room, I'm going to do the assessment. So I'm going to assess the allergies to medications of the patient. And I'm going also to assess the client's ability to swallow the medication, the tablets or the capsule. And also I'm going to assess the presence of vomiting or diarrhea. And I'm also going to check and assess the specific drug action, classification, side effects, interaction, and also adverse reactions. And aside from that, I'm going to assess the client's knowledge and learning that needs about the medication. And also, I'm going to perform the appropriate assessment specific to the medication. So next, I'm going to do the planning. So now, I'm going to assemble the equipment needed and supplies. So first, I have here a medicine tray, a disposable cup, and this is a paper cup for tablet or capsule. Sterile syringe without needle, and this is used if needed. A medicine glass, a drinking glass for water or juice, and of course, the capsule or the medicine. So the next one is I have to know the reason why the client is receiving the medication. And I must know the drug classification, the contraindication, and the usual dosage range, the side effects of the medication, and the nursing consideration. And this is for administering and evaluating the intended outcomes for the medication. And also, I forgot, I have also here a medication ticket. So, dito ko malalaman ang doctor's order, kung anong oras, kung what are the dosage, what is the name of the drug that I will be administering to the patient. So, aside from that, I'm going also to check the medication ticket for the drug. So, now I'm going to read the medication ticket for the drug name, for the dosage, the frequency, the route of administration, the expiration date for administering the medication, and if it is unclear or there is missing, I will report any discrepancies to the charge nurse or the physician. And after that, I'm going to verify the client's ability to take medication orally. And after that, I'm going to organize the supplies and place the medication tray outside the client's room and assemble the medication ticket for each client together so that the medications can be prepared for one client at a time. And now, I'm going to wash my hands in order to protect my patient and myself from the risk of infection and the cross-contamination. now I'm going to prepare the medication tray. So here is the medication tray. And now I'm going to read the medication ticket. So here is the medication ticket. And I will going to take the appropriate medication that is according to the doctor's order. And I'm going to get it or to take it here from the shelf. So here it is. And then I'm going to compare the label. I'm going to compare the label of the medication from here to the medication ticket. And also, I'm going to check the expiration date of the drug. And if it is expired, I'm going to return the drug into the pharmacy. Now, I will only use the medication that is very clear and legible label. So now I'm going to prepare the medication. So here is the medication. And now I'm going to calculate the medication dosage accurately. So I'm going to calculate it using this calculator. After that, I'm going to prepare the correct amount for required dose. So I'm going only to get this and cut para makuha ko yung required amount of dose. And put it in the medicine tray. And then put it back on the box. So after preparing it without contaminating the medication, I'm going to recheck the my prepared drug container with the medication ticket. So I'm going to recheck it. Including the expiry date, the labels, and the accurate name of the drug. And for the tablet, I'm going to place the package unit dose capsule directly into the medicine cup. So here is the medicine cup. And I will not remove the medication from the wrapper. So here, I will not remove it yet until at the bedside of the patient. And I will also keep the narcotics and medications that require specific assessments such as pulse measurement, respiratory rate, and also blood pressure. And I will break scored tablets only if necessary to obtain correct dosage. So I will use a file or cutting device if needed. And if the client has difficulty of swallowing, I will crush the tablets to a fine powder, then mix it with small amounts of soft foods. So for the liquid medication, I'm going to get the liquid medication. Like for example, this is a liquid medication, and I will thoroughly mix the medication before pouring. So I'm going to mix it. And I will discard any change in color or turned cloudy. So I will observe first. So it is okay. And I'm going to remove the cup. We'll hold the bottle So the label is next to my palm. And pour the med away from the label. And I'm going to hold the medication cup like this. I'm going to hold the medication cup, and at the eye level, this is the medication cup at eye level. And after that, I'm going to fill it to the desired level. Okay. And before capping the bottle, I will wipe the lip with a paper towel. So, like this. And then discard. And when giving small amounts of liquid like less than 5 ml, I will prepare a steel syringe. So here I have here a steel syringe without needle. So this is to keep unit dose liquids in these packages and open them at the bedside.
Dayon.
Hello, ma'am.
Hello.
Good afternoon, ma'am. Ilak na nakuportahan, ma'am, ha? Okay lang, ma'am, to provide privacy.
Okay lang.
Ma'am, ako si Hannie Rellon from Brokenshire College of Davao na ako diri karon, ma'am, para mag-administer og tambal. Pwede na ako mabala nimong pangalan, ma'am?
Oo, Susan Rellon.
Susan, sige. Kung tanawon ako ang imong badge sa kamot, ma'am, ha? Okay. So, karon, ma'am, maghatag tambal. Okay lang sa imong kana na position, ma'am?
Oo, okay lang.
Or komportable na kaana, ma'am? So, karon, ma'am, kay magkuha ko og blood pressure nimo, ma'am, ha, og pulse rate, og respiratory rate. Okay lang, ma'am?
Okay lang.
Sige, ma'am. Sige, ma'am. Okay, so maghatag ko, ma'am, orally sa imong tambal. So, akong i-administer na tambal sa imuha, ma'am, kay gikan ni siya kay Doktor Yongko. Ang pangalan ani, ma'am, kay Omega H3. Ang Omega H3, ma'am, is a concentrated blend of a vitamins, minerals, amino acids, cod liver, and also garlic. Mas kani siya, ma'am, kauban ni naapoy mga kauban which includes magnesium and pantothenic. And kana siya, ma'am, para na siya ma-help o maintain ang normal energy na ginarelease sa imong lawas. So, magpadayon ko, ma'am, ha? O kuan, okay lang sa imo, ma'am?
Okay lang,
O, sige. So, ma'am, mauna ni ang tambal, ma'am, na order ni doktor na imong inumon. Tapos ang oras karon, ma'am, kay alas 6 na. So okay na kaayo, ma'am, kay alas 6 man ang time na paimnon ka ni doktor ani.
Salamat.
Salamat pud, ma'am. So now I'm going to document each medication given. And I will also record the medication given, dosage, time, the patient's complaint, and my signature. And after that, if the medication was refused or omitted, I will also record this fact on the appropriate record and document the reason when possible. And also, I will going to record the nurse's action according to the agency policy.
Leon.
Hello, ma'am.
Hello.
Good afternoon, ma'am. Ma'am, gilak na ko ang ma'am, for privacy. Ma'am, I am Hannie Rellon from Brokenshire College of Davao. Ako to naghatag sa mong tambal kaganina, ma'am. Mangumusta lang ko, ma'am. Kumusta lang ka, ma'am?
Maayo.
Wala kayo na ramdaman ng mga side effects, ma'am, sa mong tambal?
Wala.
Wala, sige. So, ma'am, balik lang ko, ma'am, ha. Tawagan lang ko, ma'am, kung na ako'y kailangan. Sige, ma'am. Thank you, ma'am.
Thank you.
So next that I'm going to do is my return demonstration on preparing medication from ampule. So first, I'm going to assemble the equipments and supplies that are needed. So I have here an ampule, like for example, as if this is an ampule. And I have here a needle, a 5cc syringe needle. I have also here a filter needle, a 3x3 gauze pod, and also an alcohol swab. So now I'm gonna check the label of the ampule against the medication ticket. I'm gonna check the expiration date, the name, the label of the ampule against the medication ticket. There are 3 things that I must do before I give the medication to the patient. First, I will read first the label when it is taken from the shelf, from the drawer, or medication cart. Second, before opening or withdrawing the medication, I will read the label on the medication against the order or medication ticket. And the last one, I will do the same thing as what I have do earlier, and I'm going to do that after withdrawing the medication or before replacing onto the shelf, drawer, or medication cart. And after that, I'm going to wash my hands in order to prevent an infection and to reduce the number of microorganisms. And the next one, I'm going to prepare the ampule. So here is my ampule for drug withdrawal. So I'm going to flick the upper stem of the ampule for several times with a fingernail. So like this. And holding the upper stem of the ampule and shake the ampule. Because the rationale behind this one is storage may cause the medication to reach the upper portion of the ampule. So the next one that I'm going to do is to partially file the neck of the ampule if necessary. So the rationale behind this one is to start a clean break. So the next one that I'm going to do is to place a piece of sterile gauze pod between my thumb. So I'm just gonna open this. So I'm gonna place this sterile gauze pod between my thumb and the ampule neck. So like this. And break off the top of the ampule by bending toward me. Because the rationale behind this one is to protect my hand from cuts. Then I'm gonna dispose the top of the ampule in the sharp container. Because the rationale behind that one is that the glass edges could cut through plastic and injure the another person, especially the one who performed the housekeeping. So we should be dispose the sharp one or the top of the ampule to the sharp container in order to protect everyone and to be safe. So the next one that I'm going to do is to withdraw the medication. So I'm gonna place the ampule on a flat surface area. So like this is a flat surface area. Because the rationale behind that one is that the filter needle prevents the aspiration of particulate matter in the syringe. So, like for example, this is a filter needle. So, I'm gonna remove the cap of the filter needle and I'm gonna insert the needle to the center of the ampule. And then, I'm gonna withdraw the amount of drug required for the dosage. And then, with a single dose of ampule, I'm gonna hold the ampule slightly on its side, if necessary, because the rationale behind that one is to obtain all the medication. And then I'm gonna replace the filter needle with a regular needle, and then I'm gonna tighten the cap of the hub of the needle before injecting this to the client. So now I am ready to administer this medication from the ampule to my patient. But before that, I'm going to wash my hand first. So that's all. Thank you. So next, I'm going to do the return demonstration on preparing medications from vials. So I have here a vial and a 5 cc syringe with 23 gauge and 1-inch needle, an alcohol swab, and also another syringe with a 25 gauge and 1-inch needle. So now I'm going to prepare the medication vial for drug withdrawal. So I'm going to mix the solution if necessary by rotating the vial between my palms. So here of the hands. So I'm not going to shake it because the rationale behind that one is that shaking can be create air bubbles which will be difficult to remove from the syringe. So I'm just going to do like this. Like that. And now I'm going to clean the rubber cup of the vial because it is a previously opened vial with an antiseptic or alcohol swab by wiping it in a circular motion. Discard after cleaning because the rationale behind that one is to obtain the maximum antibacterial action. So now I'm going to withdraw the medication. So I'm going to attach a filter needle. So here is my filter needle because it is as agency practice dictates to draw up premixed liquid medications from multi-dose vials. So here it is. And then I'm going to prepare it now. So I'm just going to remove it and attach to filter needle. So I'm just going to ensure that the needle is firmly attached to the syringe. So here it is now. It is firmly now attached to the syringe. And now I'm going to remove the cup from the needle and draw up into the syringe and the amount of air equal to the volume of the medication to be withdrawn. So I'm just going to touch here, not in the plunger because the plunger part or area is sterile. Then I'm going to carefully insert the needle into the upright vial through the center of the rubber cup. So here is the center of the rubber cup. It is important to carefully insert the needle into the upright vial through the center of the rubber cup because it's maintaining the sterility of the needle. So I will be keeping the bevel of the needle above the surface of the medication because the rationale behind that one is to prevent a vacuum when the medication is withdrawn. So it's keeping the needle above the medication, prevent the air from mixing with the medication. So I'm just going to tap the syringe barrel, so here, to dislodge any air bubbles that is present in the syringe. So the rationale behind that one is that the vibration will cause the bubble to break loose and rise into the fluid to the top. So now I'm going to replace the filter needle that is used. So now I replace the needle that is used with a regular needle, then I cover it with the correct gauge and length before injecting the client. So I am now ready to administer the drug to my client. But before that, I'm going to wash my hand first. So that's all. Thank you. So next, I'm going to do my return demonstration in preparing and using multi-dose vials. So I have here a multi-dose vials, and I'm going to use a 1 ml or 1 cc syringe with 25 gauge and 5/8" needle and an alcohol swab. So first that I'm going to do is to read the manufacturer directions, because the rationale behind that one is that the directions may vary depending on the manufacturers. And after that, I'm going to clean the top of the vial, of diluent the vial of the powder with alcohol swab. So here is my alcohol swab. Then discard. So after that, I'm going to prepare my needle. So while drying the alcohol swab. So here is my needle, and I'm going to remove the cup. Then I will pull out a 0.1, so without touching the plunger, because the plunger side here is sterile. So I'm just going to touch here, in here. Then so 0.1. And then I'm going to withdraw an equivalent amount of air from the vial before adding the diluent. So now I'm going to withdraw it. So withdraw an air. And after that, I'm going to do like this. And then add the amount of sterile water. 0.1. So it's like we have an air bubble air. So I'm going to just do like this to pull out the air bubble. So it's gone now. Once I withdraw my 0.1, I'm going to take it out now. If the multi-dose is reconstituted, I will label the vial with the date and time when it was prepared and the amount of the drug contained in each milliliter of the solution. So I'm going to label it now. The date, the time, and the amount. Okay. So now, once the medication is reconstituted, I will store it in a refrigerator. So, that's all. Thank you. So next, I'm going to do my return demonstration on mixing medication using one syringe. So I have here a syringe, which is a 5 cc syringe, and have a 23 gauge and 1" needle. And I have here a 2 vial, this one, the vial A and the vial B. And also I have a 2 alcohol swab. So these are the equipments and supplies that are needed for the mixing medication using one syringe. So first, I assembled the equipments and supplies. And the second one, I'm going to check the medication ticket. So here is the medication ticket. And after that, so before preparing and combining the medications, I'm going to ensure that the total volume of the injection is appropriate for the injection site. There are 3 things that I must do before I give the medication to the patient. First, I will read first the label when it is taken from the shelf, from the drawer, or medication cart. Second, before opening or withdrawing the medication, I will read the label on the medication against the order or medication ticket. And the last one, I will do the same thing as what I have do earlier. And I'm going to do that after withdrawing the medication or before replacing onto the shelf, drawer, or medication cart. And now, I'm going to wash my hands in order to protect my patient and myself from the risk of infection and the cross-contamination. And the next one, I'm going to inspect the appearance of the medication for clarity. So, I'm going to check the vial A first. So, as you can see, it is very clear. So, it is good. And next, I'm going to check the vial B. Okay? So, as you can see, the vial A and B are also very clear. So, these vials are very good. So, the rationale behind that one is to make sure that the medication that I'm going to administer to my patient is good and will not produce any problem, because there are some medications are always cloudy, so it is not appropriate or it is not good to administer to our patients. And in using insulin, I will thoroughly mix the solution in each vial prior to admission. So I'm going to rotate the vials between my hands or the palm of my hands and invert the vials like this. Like that. But in this case, I'm not using an insulin. So I'm just going to clean the top of the vials with the antiseptic swab or alcohol swab. In circular motion. And then discard. Then this, I'm going to remove the cover. And then I'm going to open this and clean in circular motion. Then discard. And after that, I'm going to withdraw the medication. I'm just going to open this. So now I have here a 5cc syringe. So I'm just going to remove the cap. And then I'm going to draw back it to get an air for at least 2. So now I'm going to give an air to the first vial or for the vial A for at least 1 ml. And the next 1 ml, I'm going to give an air to the vial B. And after that, after giving an air, I'm going to do like this to withdraw the medication from vial B. So I'm going to withdraw a 1 ml. Carefully not to touch the plunger because the plunger is sterile. And now I'm going to withdraw the medication from vial A. Then to do like this, then slowly withdraw the medication until I reach the 2 ml. Slowly withdraw it. And now I'm just going to do like this because there's a bubble air. And after that, I'm going to get it and cover. So now I have a mixing medication in using 1 syringe. So I am ready now to give this medication to my patient. But before that, I'm going to wash my hand first. That's all. Thank you. So the next one that I'm going to do is to mix the medication from 2 vials. So I'm going to take the syringe, and after that I'm going to draw up a volume of air equal to the volume of medications to be withdrawn from the both vial A and B. So I remove already the cup. So I'm going to draw a 4 ml of air because 2 ml by each vial. So now I'm going to inject the first 2 ml air to the vial A. So I'm gonna give an air for at least 2 ml. So I'm just gonna make sure that the needle is not touching the solution like this. So it's not touching the solution, as you can see. And then I'm gonna withdraw the needle from vial A. And the next one that I'm going to do is to inject the remaining air to the vial B. So this is the vial B. And then give an air for at least 2 ml. And after that, I'm gonna withdraw the required amount of medication from vial B. So I'm gonna withdraw a 2 ml of medication from vial B without touching the plunger because the plunger itself is sterile. So slowly withdraw it in order to achieve 2 ml of medication from vial B. And then withdraw. So now after withdrawing a medication from vial B, I'm gonna cover it and change the needle. So I'm gonna remove the needle that I'm using to withdraw from vial B. So using a newly attached sterile needle, I'm gonna withdraw the required amount of medication from vial A. So the vial A is this. So I'm gonna remove the cup. And I'm gonna get a 2 ml of medication. Slowly until I get the 4 ml of medication. So the syringe now contains a mixture of medication from vial A and B. So I'm just gonna cover the needle to maintain its sterility. So in addition, mixing med from one vial and one ampule first, prepare and withdraw the medication from the vial. Then withdraw the required amount of medication from the ampule. So now I have here a mixing medication from 2 vial. So that's all. Thank you. Good afternoon, ma'am. I am Hannie Rellon, and now I'm going to do my return demonstration in administering an intradermal injection. So, first of all, I'm going to assess the appearance of injection site. Second is that I'm going to assess the specific drug action and also the expected response. And the third one, I'm going to assess the client's knowledge of drug action and response. So the next one, I'm going to do the planning. I'm going to assemble the equipments and supplies that are needed for administering the intradermal injection. And I'm going to check the medication ticket and compare the medication from the medication to the medication ticket. And because the rationale behind that one is to make sure that the content that the medication that I am being prepared is correct. There are 3 things that I must do before I give the medication to the patient. First, I will read first the label when it is taken from the shelf, from the drawer, or medication cart. Second, before opening or withdrawing the medication, I will read the label on the medication against the order or medication ticket. And the last one, I will do the same thing as what I have do earlier. And I'm going to do that after withdrawing the medication or before replacing onto the shelf, drawer, or medication cart. And now I'm going to wash my hands in order to protect my patient and myself from the risk of infection and the cross-contamination. Hello, ma'am. Good afternoon, ma'am. Good afternoon, ma'am. I am Hannie Rellon from Brokenshire College of Davao. Ma'am, pwede nang mabalan yung pangalan? I-check na lang sa dako ang ano, ma'am, ha? Kanang inyong identification risk diri sa kamot. Okay. Ma'am, pwede na mo i-state inyong birthday? Okay, ma'am. So, ma'am, na ako diri karon, ma'am, para mag-administer og medication sa imuhang intradermal. So, mag-inject ko karon, ma'am. Tapos, ma'am, i-explain lang sa nako, ma'am, na after nako og inject sa inyuhang intradermal na area, kay ano siya, ma'am, mag-produce siya og small bleb. Ang small bleb, ma'am, kay mao na siya ang kanang formation po sa skin na naga-indicate that the needle was properly placed and the medication has been delivered to the dermal space. So, ang bleb, ma'am, kay mawala lang na siya, ma'am, after a few minutes as the medication is dispersed and absorbed into the surrounding tissue po. So, wala kayo kay ikabahala, ana, ma'am. Okay lang sa imo, ma'am, magpadayon ko, ma'am. Bali, diri lang ko mag-inject, ma'am, oh. Sige, ma'am. Mag-andam lang po, ma'am, ha. Magsuot lang ko og gloves. Sige po. Hello, ma'am. Ma'am, limpyuhan lang ako ang site, ma'am, ha, kung asa ko mag-injection. Bukasan ako ni ma'am. So, limpyuhan ako ni siya, ma'am, ang imong skin sa kung asa ko mag-inject from in circular motion, starting at the center and widening the center outward. Yan. Tapos ilabay. Then, ma'am, i-prepare lang ako ang syringe, ma'am, ha. Galo na ako ang taklog sa syringe, sa needle. Tapos, while nagahulat ko sa antiseptic na mo mauga. Ang sumutusok na ko, ma'am, ha. So, human na, ma'am. Dili na ko siya i-massage, ma'am, kaya dili man pwede. And now, I will going to document all the relevant information and I will record the testing material given, including the time, the dosage, the route, the site where I inject, and the nursing consideration and assessments. The next one is I'm going to administer a subcutaneous injection. So first, I'm going to assess the patient into his or her allergies to medication, and I'm going to assess the specific drug action, the side effects, and adverse reaction. And lastly, I'm going to assess the client's ability to cooperate during the injection. So the next one, I'm going to do the planning. I'm going to assemble the equipments and supplies that are needed, and I'm going to check the medication ticket and compare the medication from the medication to the medication ticket. And because the rationale behind that one is to make sure that the medication that I am being prepared is correct. Hello, ma'am. Ma'am, ilock lang na, ay saratan lang ako ang door, ma'am, ha, kay para to provide privacy. So, ma'am, ako si Hannie Rellon from Brokenshire College of Davao po. Na ako delikat, ay ma'am, pwede na akong mabalan nimong pangalan. Okay, ma'am, i-check na lang po na ako ang imuhang identification band, ma'am, ha. Okay. So, ma'am, kanang na ako diri karon, ma'am, kay maghatag ko og mag-inject ko sa imuha og subcutaneous injection na tambal. Ang tambal, ma'am, kay heparin. So wala ba kay allergy, ma'am, sa heparin, or naa ba kay alam about sa heparin? Okay. So ma'am, karon ma'am, maghatag ko og kanang mag-inject ko sa imuha og heparin. Kay ang heparin, ma'am, injection, kay mao na siya ang anticoagulant na ginagamit para mag-decrease ang blood clotting ability sa dugo. So, mo na siya ma-prevent ang harmful clots from forming blood vessel. So, okay lang sa imo ma'am, magpadayon ko. Sige ma'am. So, ma'am, diri lang ko dapat ma-inject ma'am ha. Wala pa mang kanin na injection na diri dapat. Okay. So, okay lang si ma'am, diri ko mag-inject. Kay, nakita mo na ko ma'am, na kani siya na site kay free of tenderness, swelling, itching, and also burning, and localized inflammation. So, nag-select lang po ko og site ma'am kung asa wala kayo ginagamit kung mag-inject ni or mag-administer og tambal through injection. So, okay lang sa ma'am, magpadayon ko. Sige ma'am, mag-gloves lang ko ma'am ha, tapos i-prepare lang po na ako ang tambal. Salamat ma'am. Hello ma'am. Ma'am, na ako'y dala diri ma'am, antiseptic swab. So, limpiwan na ako ang site ma'am ha, kung as ko mag-inject. So ma'am, limpyo na ko ma'am ha. Ikan ko diri sa center, pa white. So, up to 5 cm or 2 inches. So, karon ma'am, i-prepare na nako ang tambal ma'am ha. So, i-open na nako ang cup sa needle. Okay, naghulat man po ko na mauga ang kanang antiseptic. Tapos, mag-release lang ko bubbles. So, ma'am, mag-inject na po ma'am ha, mga nasa 45 degree angle. So, ma'am, ma'am, tapos wala man po siya nagdugo. So, okay na siya ma'am, dili lang ako nilagtan ma'am ha. Dili lang ako magbutaw ka wala man siya nagdugo. Okay ma'am. Sige ma'am, ilabay sana ako ng injection ma'am. Kaala na ako ni taklo. Balik na ko niya ma'am ha. Ilabay sana ako ni ma'am. Now, I'm going to document all the relevant data and information, and I will also document the medication, which includes the medication given, the dosage, the time, and the routes, the site, and any assessments. Many agencies prefer that the medication at the time it is the act. So the next one that I'm going to perform is the administering an intramuscular injection. So first, I'm going to assess the client's allergies to medication. Second, I'm going to assess the tissue integrity of the selected site. So I'm going to select the deltoid site, which is here, which is the left side of the patient. And the next one, I'm going to assess the client's age and weight, and to determine the site and needle size. So I'm going to inject the 5cc syringe of Teromo syringe. And the last one, I'm going to assess the client's ability or the willingness to cooperate during the intramuscular injection.
Dayon.
Hello, ma'am.
Hello.
Good afternoon, ma'am. I am Hannie Rellon from Brokenshire College of Davao. Pwede mo mabalang pangalan, ma'am?
Si Susan Rellon.
Okay. Ma'am, i-check na lang po na ako ang ma'am ha, kanang identification band nimo to make sure. Okay, so ma'am, na ako diri karon ma'am kay mag-inject ko sa imong ha og kanang antibiotic penicillin. So okay lang sa imuha, ma'am.
Kailan?
Kanang ano siya, ma'am, kanang order siya ni doktor. So i-assist anti ka, ma'am, into sitting position kay diri man ko sa deltoid nimo na muscle mag-inject, ma'am. Sige, lingkod lang ka, ma'am. Diri ka, ma'am. Ang penicillin antibiotic, ma'am, kay gina-inject na mo na siya or ginahatag sa inyuha kay para mag-stop ang ang bacteria na mag-multiply gani, ma'am, and gina-prevent sad, ma'am, ang pag nila, ma'am, kanang pag firm sa walls na kung asa na asa imong lawas. So kailangan inject kanang matagaan na dayon ka og penicillin na antibiotic. So napili na ako, ma'am, diri adapit sa deltoid na muscle. Mao na ang site na akong injeksyonan. Na injeksyonan na ba ni, ma'am, or wala pa?
Wala pa.
Wala pa, ma'am, no? Sige, so diri ako napili, ma'am, sa imong left side. So okay lang sa imong, ma'am.
Okay lang.
Sige, ma'am. So kani ako napili, ma'am, kay free man gud siya, ma'am, sa tenderness, sa swelling, sa itching, burning. So indaw, ma'am, tanawon daw nako, ma'am. Okay, so okay kay siya injection, ma'am, no? Wala kayo siya kanang swelling, itching, burning, and localized inflammation. So okay lang si mama, magpadayon ko.
Okay lang.
Ano lang ko, mama, mag-gloves ko, ma'am. Sige, ma'am, na ako'y dala diri, ma'am. Mao na ni siya ang penicillin na antibiotic o kani, ma'am, kay antiseptic swab. So limpyuhan na nako ang area, ma'am, ha, kung asa ko mag-inject. So from the center outward into for about 5 cm or 2 inches. So now I will remove the cap of the needle. So while waiting, ma'am, na mauga ang kanang basa sa antiseptic wrap, ako sa sa ako diri og bubbles. Sige, ma'am, mag-inject na ako karon, ma'am, ha. So now I'm going to inject the medication using a Z-track technique. So like this. In using the ulnar side of the non-dominant, which is this my left side hand, to pull the skin approximately 2.5 to 1 inches to the side. So like this. And then I will hold the syringe between the thumb and forefinger, pierce the skin quickly and smoothly at 90-degree angle. So like this. And then I'm going to insert the needle into the muscle. So here, the muscle here is the deltoid. So I'm going to inject now, ma'am, ha. I will hold the barrel of the syringe steady with my non-dominant hand and aspirate or pulling back on the plunger. I will pull back the plunger with my dominant hand. So pull back the plunger and then aspirate for 5 to 10 seconds. So after injection, I will wait for 10 seconds and withdraw the needle. So I withdraw it with the same angle smoothly. And then I will apply a gauze pad, a dry gauze pad, because there is a bleeding. So I will just not massage the area, because massaging the area or the site can increase the solution going into the subcutaneous tissue. So the nurse must not massage the area. And now, I will going to document all the relevant information, and I will record the testing material given, the time, including the time, the dosage, the route, the site where I inject, and the nursing consideration and assessments. Good day, ma'am! And now I'm going to demonstrate the ophthalmic installation to my patient. So this, when we say ophthalmic, this is through the eyes. So first, I'm going to assess of the eye. So here, the left and the right eye of the patient, and the surrounding structures for lesion, erythema, or swelling. And also, I'm going to assess the location and nature of the any discharge that is present in the eyes that I can see, the lacrimation, the swelling of the eyelids, so here, or the lacrimal gland. And also, I'm going to assess the client's complaints such as itching, burning pain, blurred vision, and photophobia. So I'm going to ask the clients about it. And also, I'm going to assess also the client's behavior such as squinting, blinking, excessively frowning, or rubbing the eyes like this. So it is important to assess the clients first before giving the medication. After assessing my clients, I'm going to check the medication ticket for the drug name, the dose, and the strength of the medication, of the drug. And after that, if the medication ticket is unclear or pertinent information is missing, so I'm going to compare it to the physician's written order in order for me to check or recheck that the medication is correct, and so that there will be no problem after giving the medication. I will also report any discrepancies as agency policy dictates. I must know why the client must given that kind of medication through the eyes, and why she or he is receiving the medication. I will must know the drug classification, the contraindication, and also I'm going to check the label with the medication record and check the expiration date. It is important to check the expiration date so that the patient could receive the drug with no problem. So it is very important to check about that. And I'm going to calculate the medication dosage if needed. Before I'm going to the patient, I'm going to wash my hands first. And now I'm going to wash my hands in order to protect my patient and myself from the risk of infection and the cross-contamination. Hello, ma'am. Good afternoon, ma'am. Ma'am, gilak na ako ang portahan, ma'am, to provide privacy. Okay lang sa imo, ma'am? Okay, ma'am. So, ma'am, I am Hannie Rellon from Rellon College of Davao po. Ma'am, pwede na ako mabala ng imong pangalan, ma'am? Okay, ma'am. Okay, no. I-check na lang po na ako ang imong client identification card, ma'am, ha? Na-address mo ka mo. Okay lang, ma'am? Okay, ma'am. Okay. So, karon ma'am, na ako'y dala ophthalmic solution, ma'am. Kani siya, ma'am, kay para ni siya i-treat ang imuhang glaucoma nga naa sa mata. So, okay lang sa imuha, ma'am, na magpadayon ko. Okay, ma'am. Sige, ma'am. So, karon ma'am, i-assist lang tika, ma'am, kung unsay mong comfortable na position. Comfortable na kaani, ma'am, na maghigda ka nga maghatag ko o ophthalmic installation, or ano pa ko, ma'am, i-assist ka na maglingkod ka or higda lang. Okay, ma'am, higda lang imo, ma'am. O sige ma'am, so karon ma'am, limpyuhan sa nako ang imuhang eyelid and the eyelashes ma'am ha. Sige, ibutas sa nako ni ma'am. Limpyuhan na nako ma'am, imuhang unahon ako limpyo ma'am ang imuhang eyelashes and eyelid. Okay, ma'am. Ma'am, okay na, ma'am. Nalimpyo na, ma'am. Magsuot lang sa ko gloves, ma'am, ha? O, sige, ma'am. Hello, ma'am. Ma'am, karon ma'am, na ako dala ka ng, ma'am, kani sterile cotton balls, moistened with the sterile normal saline. So, okay lang sa imo, ma'am, na kanang i-wipe na ko ni siya, ma'am, from your inner canthus to the outer canthus. Yes, ma'am. Kailangan jud, ma'am. Kaya ang rationale behind that one po is to prevent the contamination of the other eye and the lacrimal ducts. Okay lang, ma'am? Sige, ma'am. Mapalayan ko, ma'am, ha? Sige, ma'am. From inner canthus po to the outer canthus. Discard na ako ni ma'am. Okay na, ma'am. Sige, ma'am. So, karon ma'am, mag-administer na ko og eye medication, ma'am. I-check lang po na ko ang ophthalmic preparation, ma'am, for the name, the strength, and number of drops. Okay lang, ma'am? Sige, ma'am. So, ma'am, karon ma'am, i-instruct lang tika, ma'am, ha, na mutanaw ka sa ceiling. Opo, ma'am. Kaya ang rationale behind that one, ma'am, kay para po less likely na mag-blink ka while looking sa taas. Yes, ma'am. O maprotektahan po ang upper eyelid. Okay, ma'am. So, karon ma'am, i-expose na ako ang imong lower conjunctival sac, ma'am, ha? So, i-place lang na ako ang ma'am, ako ang thumb sa imong lower. Okay lang, ma'am. So, i-place na ako akong thumb, ma'am, ha, sa imuhang cheekbone. Yan, below lang sa eye, ma'am. Sige po. Kaya ang rationale behind that one, ma'am, is to minimize the touching of the cornea. And ma-avoid po na to, ma'am, na ma-put of any pressure on the eyeball. So, diri, ma'am. And ma-prevent po, ma'am, ang kanang imuhang pag-blink and squinting. Yes, ma'am. Parayan ko, ma'am, ha. And magbutan ako correct number of drops, ma'am, ha. Sa outer third of your lower conjunctiva sac po. Sige, ma'am. So, ang pagbutang na po, ma'am, is ang dropper is from 1 to 2 cm above the sac po. 1, 2, 3. Okay, ma'am. So, ma'am, pwede nyo i-close ang imuhang eyelid, ma'am. Pero ayaw lang siya i-squeeze, ma'am, ha? Oh, yes, ma'am. Kaya ang rationale behind that one, ma'am, is to closing the eye and then ma-spread mo siya, ma'am, sa ma-spread ang medication over the eyeball. So, ang squeezing po, ma'am, can injure sa imuhang mata and ma-push out ang tambal. So, ayaw lang siya ma'am, ha? Okay na, ma'am. Thank you, ma'am. Mubalik lang ko niya, ma'am, ha? Kay assess ako balik kung kumusta ka o imuhang mata. Kay para ma-evaluate lang po na ako kung okay ba ang resulta sa imong tambal. So, manghugasan sa kong kamot, ma'am. Sige, ma'am. Thank you po. For the additional information for the liquid medication in giving ophthalmic instillation to the patient, press firmly or have the client press firmly on the nasopharyngeal duct for the at least 30 seconds, because the rationale behind that one is to prevent the medication from running out of the eye. So here, and down the duct. So that's all. Thank you. So the next one that I'm going to do is to demonstrate the administering of otic instillation. So when we say otic, it is here in the ear, or it's either left or right ear. So first, I'm going to assess the appearance of the pinna. So here is the pinna of the ear and the metals or signs of the redness or abrasions. And now I'm going to assess also the time of amount and any discharges that is present in the ear that I can see in the ear. So here. And then after that, I'm going to assess also to determine if the assessment of the data influences administration of the medication. So let's start. After assessing my clients, I'm going to check the medication ticket for the drug name, the dose, and the strength of the medication, of the drug. And after that, if the indication ticket is unclear or pertinent information is missing, so I'm going to compare it to the physician's written order in order for me to check or recheck that the medication is correct, and so that there will be no problem after giving the medication. And now I'm going to wash my hands in order to protect my patient and myself from the risk of infection and the cross-contamination. Hello, ma'am. Ma'am, gilak lang na ako ang portahan, ma'am, ha, to provide privacy. Okay lang sa inyo, ma'am? Sige po. So, ma'am, I am Hannie Rellon from Vocational College of Davao. I'll be your student nurse for today. Ma'am, pwede na ko mabala ni mong pangalan? Sige po. I-check na lang po na ako ang client's identification band, ma'am, ha? Naanong diri sa mukha mo, ma'am? Okay, ma'am. So, ma'am, karon ma'am, na ako dala tambal, ma'am, for the otic installation. Ito po yun. So, kani siya, ma'am, kana ginahatag na mo ni ma'am para sa imuhang ear to prevent ear infection and also to help remove earwax. So, okay na si mo, ma'am, na magpadayon ko. Sige po. So, karon ma'am, i-assist lang ka, ma'am, kung asa mong comfortable position. Side lying lang, ma'am. Okay, ma'am. Side lying lang po. Sige, ma'am. Bagasan ako ni ma'am, ha. Sige, ma'am. I-assist lang ka, ma'am, ha. Patakilid. Sige, ma'am. Maghabol lang ka, ma'am. Sige po. Tugnaw mo ng aircon, ma'am. Anak, ma'am, okay na ka, ma'am? Sige po. So, karon ma'am, limpyuhan ako mong pina, ma'am, ha, sa imuhang diri, ma'am, sa ear. Muna siya ang pina, ma'am, kanina. Yes, muna siya, ma'am. And limpyuhan sa nako ang metus, ma'am, of the ear canal. Opo. So, if the infection is suspected, I'm going to wear my gloves. But, in this case, there's no infection suspected. So, I won't wear my gloves. So, ma'am, ang limpyuhan ako ang imuhang ma'am, pina, ma'am, because the rationale behind that one, ma'am, is to remove the present discharge and also to prevent it from being washed into the ear canal. So, dito po sa ear canal, ma'am. Opo. So, ma'am, mag-use ko ma'am, ha, cotton tip applicator. Yes. And solution to wipe the pina, ma'am, and auditory metus. Sige po. So, ma'am, mauni siya ang cotton tip applicator, ma'am. Sterile po ito. Opo. So, ako ala na yung limpyuhan, ma'am, ha? So, karon ma'am, ito na po yung medication, ma'am, na sinasabi ko kanina. And i-warm sana ko ni ma'am ha ang container in my hand. Because the rationale behind this one is to promote the client's comfort. Yes, ma'am, to your comfort. Di ba ma'am, pag bugnaw kayo, kay murag makalitan, manta. Yes, tinuod yun na, ma'am. Tapos ma'am, kung warm, ma'am, kay medyo comfortable man na siya, ma'am. So, pag ibutanan ako sa mga dalungan, di na nakamakalitan. So, karon ma'am, I'm going to partially fill the eardropper with the medication. So, as if this is a dropper, and then this is a medication. So, butanan ako ni tambal, ma'am, ha. Umaunin siya ang dropper, ma'am. Ready to drop na. So, karon ma'am, straighten lang nako ang auditory canal, ma'am, ha. Tapos, ipulang nako ang pina ni mo, ma'am, upward and backward. So, okay lang, ma'am. Sige po. So, upward and backward. Because, yes, ma'am. Kaya ang rationale behind that one, ma'am, is to straighten the auditory canal so the solution can flow the entire length of the canal po. Opo, ma'am, diretso siya, ma'am. So, karon ma'am, mag-instill na ko, ma'am, ha, of correct number of the drops along the side of the ear canal. So, yes, ma'am, i-press lang ako ni gently, ma'am, but firmly of few times on the tragus of the ear canal. So, 1, 2, 3. So, ma'am, ang rationale behind that one, ma'am, at ang ibuhat ka ganina, is to assist the flow of medication into the ear canal. Kaya kung dili man ako siya i-ano, ma'am, kanang i-press upward and backward, kaya masig mag-stop siya, ma'am. So, lisod na, dili mapadulo sa ear canal. May man itong i-assist dyan ako, ma'am, kaya para madiretso siya. Yes, ma'am. Ma'am, i-ask lang tika, ma'am, ha, na kanang mag-remain lang kasi mong position inside lying position po for 5 minutes, ma'am. Yes, ma'am, because the rationale behind that one po is to prevent the drops from escaping, ma'am, to reach all the sides of the canal cavity. Yes, ma'am. Importante dyan siya, ma'am. Karon, ma'am, mag-insert ko og cotton fluff, ma'am, ha. Okay lang, ma'am. Yes, ma'am. Sa imong methods ko mag-ano, ma'am, mag-insert sa imong auditory canal for, ano lang siya, ma'am, for 15 to 20 minutes. Opo. Ayaw lang siya i-press, ma'am, pasulod sa, ano, canal. Kaya paano man siya. So, butanan ako, ma'am, ha. So, ito po yun, ma'am. Cotton fluff. O, butanan ako, ma'am, ha. Ayaw lang i-press, ma'am. Yes, ma'am. Yes, ma'am. Importante dyan na siya, ma'am. Kay ang cotton man good, ma'am. Kay nagatabang na siya, ma'am, para ma-retain ang medication. Tapos, kung i-press dyan na nimo siya, ma'am, tightly, kay ang cotton, ma'am, kay interfere with the action of the drug. So, lisod na, ma'am. Kung isa pa, ma'am, ang outward movement, ma'am, the normal secretion. So, ayaw lang siya i-dasok, ma'am, ha? Yes, ma'am. So, ano lang man, ma'am, for 15 to 20 minutes po. Opo. So, ma'am, oo lang to, ma'am. Thank you, ma'am. Thank you kay ma'am, ha? Balik lang po niya, ma'am. Opo. Buhata lang to kung giingon, ma'am, ha? Kaya para ang jug, ma'am, kay mo talad jud siya, ma'am. Yes. So, ma'am, balik lang po, ma'am, ha? Thank you, ma'am.